Today we will be completing the Skinfold measurements in order to assess body composition. Before beginning the assessment, you're going to make sure to mark all of the areas that you're going to do the assessment on the right side of the person's body. Only the right side is going to be used. The 7 sites that we will be measuring today include the triceps, subscapular, suprailiac, chest/pectoral region, abdominal, mid-axillary, and thigh. We will begin with the triceps. The skin site for the triceps will be located halfway between the acromion and the olecranon process on the posterior midline of the arm. You'll go ahead and place a mark with either a pen or marker. Next is the subscapular site. In order to find the inferior angle of the scapula, you will have the participant place their arm behind their back, and you'll feel for the inferior angle. Place the mark 1 to 2 centimeters below this angle. For the chest pectoral site, you will locate 1/3 of the distance between the anterior axillary line and the nipple on a woman, and for a man, 1/2 of that distance. You will need to place the participant's arm behind them in order to locate the mid-axillary skin site. This site is located on the mid-axillary line at the level horizontally to the xiphoid process. For the suprailiac skin site, you will ask the participant to locate their iliac crest, and from this point you will place the mark in line with the natural angle of the crest and in line with the anterior axillary line. The abdominal site will be located at approximately 2 centimeters to the right side of the belly button. Finally, the thigh site. This will be located between the hip and the patella on the midline of the thigh. As a general rule, the caliper should be placed directly on the skin surface, about 1 centimeter away from the thumb and finger for all skin folds. The triceps fold will be a vertical fold. For each fold, the pin should be maintained while reading the caliper. You should also always wait 1 to 2 seconds before reading the caliper, but never longer. The subscapular site will be a diagonal fold, approximately 45 degrees in angle. Make sure not to take the same measurement in the same spot twice. Always rotate through the measurement sites so that the skin can regain normal texture and thickness. For both the chest and pectoral folds, whether male or female, you will perform these folds at a diagonal. This diagonal will be perpendicular to the acromion. The suprailiac fold will also be done at a diagonal. And the abdominal fold will be a vertical fold. All folds, make sure you are not grabbing muscle or just skin. It has to only be the fat. For the mid-axillary fold, you will perform this vertically. Finally, the thigh fold, which will also be completed vertically. As a reminder, always take 2 measurements and use the mean of both measurements. And if a measurement is not within 1 to 2 millimeters, retest. The following are the 7 site formulas for men and women. Both formulas require the sum of the 7 skin folds as well as the age of the participant. Both formulas also have a standard error estimate in which the number could be off. The final 2 formulas are the Brozic and Siri formula, which use body density in order to calculate the body fat percentage.